Well, good morning, everyone. Thank you so much for taking time out of your day to join us for this most exciting announcement. I'm Rebecca Vogt. I'm the Media Relations Specialist at Roswell Park Comprehensive Cancer Center here in beautiful Buffalo, New York. We are so proud to announce a comprehensive program involving Roswell Park Indian Health Service and rural federally qualified health centers in the Western New York area. It is all possible thanks to a multi-million-dollar grant awarded by the Bristol Myers Squibb Foundation. The team's goal is to work together to expand health equity in underserved areas in our region. Now, I'm not going to give all of the details away. I will leave that to our experts. Joining us today on our panel, we have Dr. Rodney Haring. He's the director of the Center for Indigenous Cancer Research and assistant professor of oncology in the Office of Community Outreach and Engagement here at Roswell Park. Also, Dr. Kathryn Glaser, Assistant Professor of Oncology in the Department of Cancer Prevention, also here at Roswell Park. And also Catharine Grimes, who is the Director of the Bristol Myers Squibb Foundation. We will have some time at the end of this press conference to take some questions from members of the media in attendance. So please feel free to ask them at any time utilizing the chat little bubble below. We will try to get to as many as time allows. And I also want to make a note that we should on our Twitter account, which is at Roswell Park, we should have put out a tweet already with the full press release that will direct you to our online newsroom. Or if you are familiar already with our online newsroom on roswellpark.org, please go to that, and our press release should be live for you to look at all the details there. So Dr. Haring, we would like for you to start us off today. Please tell us more about the philosophy behind this new partnership and what this ambitious effort will entail.
Well, thank you for the introduction. It's a great honor. Today is a wonderful day and it's beautiful outside. Greetings and peace and wellness to everyone. Thank you for joining us. The announcement really kind of intertwines a new effort involving many partners, a commitment to tackle long-standing obstacles that have created inequity in healthcare and healthcare outcomes for our Western New York communities, but even beyond our Western New York communities across the state and among our tribal partners and native nations of the Haudenosaunee or the Iroquois Confederacy. And so the philosophy and kind of backdrop to the service that's being offered and the gracious award that we received. So we're very thankful for that. It's really it's really meaningful to our communities in that way that this notion of what's called a two-row wampum philosophy really talks about, you know, that we as Indigenous or Haudenosaunee people travel and journey in one canoe, and that our non-Indigenous partners and communities and sovereigns travel and journey in another vessel. And this goes back to the 1600s, this two-row wampum philosophy and kind of agreement between our nations, that even though that we travel on parallel journeys down a river, the real goal is to really understand that we do represent each other as sovereign nations, in this case, sovereign healthcare entities, but that we must also coexist for the health of everyone. And so by traveling together in a parallel means down a river of wellness, so to say, that we have to understand that journey and what it looks like coming from Indian health services in a tribal level into other services in the rural communities, to cancer care services across the continuum, and that we have to respectfully and with good health travel that journey together. And what does that journey look like from Indian Health Service to adjacent providers and back into the community and after? And so the real journey is health and wellness. And it isn't just for Native peoples Indian Health Services, but our adjacent federally qualified uh, health centers adjacent to their communities. And what is it? You know, the wellness of our adjacent communities is the wellness of us and vice versa. So we all need to work together in that two-row kind of philosophy and journeying through healthcare. And also within our Iroquois or Haudenosaunee philosophies are these notions of the seventh generation, meaning that the things that we do today really impact that we should have the foresight of what that means 7 generations forward. And so this amazing opportunity and this new service, both for Indigenous communities and our rural partner and our rural communities is really having the foresight to think 7 generations forward. So the health that we create in our children and the notions that we think about the children that are yet the children that are yet to come, that we provide a framework, a sustainable framework with the Indian Health Services and with Bristol Myers Squibb and Roswell Park, that we bring this notion together, looking forward 7 generations, so that the footsteps that we make today creates a healthy future for many people and many generations to come. So we're very thankful for the generous $3.3 million grant from the Bristol Myers Squibb Foundation, the partner and services across the Indian Health Service and federally qualified health centers. And what that does is it creates 6 new full-time patient navigator positions, as well as 2 virtual navigators, to kind of embed that philosophy of the two-row wampum in our healthcare systems, to coexist together, to bring wellness to our communities across New York State, Indigenous and non-Indigenous. In that the navigators, if you're not familiar with the term navigator, it's really someone who's a helper in a way, that are trained to healthcare workers who help patients or community members to understand the nuances of the medical system and to overcome barriers so they can access medical care, cancer care, along the entire cancer care continuum. And we also know that cancer doesn't always occur and by itself, and within many of our communities, both native and non-native, there are other things that happen with cancer, such as obesity and diabetes. So some of these co-occurring conditions are also important in that cancer care continuum process. With the continued partnerships between Roswell Park, the Center for Indigenous Cancer Research, the Indian Health Services, and the federally qualified health centers, guided by the two-row wampum philosophy and model that we've kind of integrated throughout this whole process, it really brings a peace, respect, and friendship that we're going to continue on with that process to bring healthcare and wellness to our communities now and 7 generations forward. So many nyawes, many thank yous to the Bristol Myers Squibb Foundation for entrusting us with an opportunity to serve our communities. We send nyawe and thank you to the Indian Health Services, our local Native nations and tribal leaders and counselors and communities, and many other people that are partnering across the health centers throughout our region and throughout New York State. All of these entities are essential partners and guides really how we move forward. And we already embraced the opportunity to help us make this effort a success. So we're very thankful, and we look forward to embarking on this two-row wampum journey together again, and in that framework of peace, respect, and friendship. So Nyawe.
Thank you so much for that, Dr. Haring. Thank you for introducing us to those beautiful concepts, and also congratulations to you on securing this important new grant. Now we're going to switch over to Dr. Kate Glaser. We'd now like you to tell us a little bit more about how this project's going to unfold and also the community needs that you're going to be tackling.
Thank you so much, Rebecca, for that introduction. And I want to thank my dear colleague and friend, Dr. Rodney Haring, for that eloquent description, and also the Bristol Myers Squibb Foundation for this opportunity. We're so excited to embark on this adventure with you together. And it is an honor today to be here and to celebrate this effort. For a long time now, we've really known about some of the inequities that exist in healthcare and health outcomes that really lead to some of these disparities in these rural and indigenous communities, especially compared to those living in more urban environments with more access to healthcare and to resources. So now we're able to move forward with this plan to really address this gap in care and these barriers that exist, and focus on really evidence-based practices that we know are working, and really data to indicate where we can have the greatest opportunity for impact. So with that being said, we are going to be able to provide with this grant on-site navigation, both to our rural and indigenous communities, focusing around the spectrum of cancer care. That really begins with the prevention and the screening, but also goes all the way through supportive care and survivorship care as well. We focus largely on working with the federally qualified health centers who serve the most underserved populations, as well as the indigenous communities adjacent, and working with Indian Health Services to really focus on those populations as well. Our primary goal of this is to focus on breast and prostate cancer, but also look at some of the more burdening co-occurring conditions that plague these communities, such as diabetes, hypertension, obesity, mental health, all the things that are even more compounded right now by the current situation. And based on our analysis from looking at screening rates across our region, we really know we're targeting some of the areas where there's lower rates of screening in those regions, and that we can really have the biggest impact, really focusing on our local Native communities, looking at our Latino and non-Hispanic white in these rural areas. And also knowing that we do experience a higher burden of cancer in those regions, particularly lung, breast, prostate, colorectal, as well as really high smoking rates in these communities as well. So we're really looking forward to trying to impact that and address that. And it's very important to also understand that a lot of these communities are really living well below the federal poverty level, already have access issues related to education and healthcare, and that really we want to try to provide services that help address this gap to help achieve this goal of health equity. And looking at these preventative measures that we know that work, such as cancer screening. We also know that these communities really do bear a disproportionate share of death due to cancer, and that there's no current navigation efforts really happening in these communities. So really focusing on that primary prevention and cancer screening, we hope to really make an impact on the cancer burden in these regions. And fundamentally, our goal is really to break this vicious cycle where we know we have these logistical challenges when it comes to access to care, financial support, and that lead to poor health outcomes and cancer outcomes, and really work on addressing this within the populations that we know are less inclined to trust the healthcare system and providers or to seek care. So we're employing a model of culturally competent, trained navigators to work with our Native partners in our rural communities and really work on building trust and sharing information and trying to link people to resources. This is really important for us to do. And our goal is to educate and engage well over 3,000 community members. Our focus is on Chautauqua, Cattaraugus, Allegheny, Niagara, and Oneida County as well. We hope to reach into the St. Regis Mohawk area. We want to really have an impact on our neighboring Tuscarora and Tonawanda Band Senecas, as well as the Seneca Nation in the southern tier and the adjacent rural communities in those areas. So the whole foundation of this grant is really to share best practices, to work together to make a difference, and link people to access and really hope bring hope and to bring us closer to achieving health equity. So thank you so much for this opportunity. Thank you again to Bristol Myers Squibb, and thank you for everyone to joining us today.
Thank you, Dr. Glaser. Appreciate that. Such exciting work to hear about, and you've explained so well how we have zeroed in on the ways to meet those needs that have gone so underserved for too long. Now, I'm going to shift again, and with great pleasure, we're now going to turn to Catharine Grimes, representing the Bristol Myers Squibb Foundation, which provided $3.3 million to make this plan a reality, and without whom these services would not be available in our community. Catharine, I pass it over to you. Catharine, you're still muted.
Well, sorry
there
about
you go.
That. Yes. Thank you, Rebecca, and thank you, Dr. Haring and Dr. Glaser. It is a real honor and privilege to be here with you all today. And before I make my formal remarks, I just want to say how much I'm really moved by this notion of the two-row wampum, and that while we're in different vessels, we're all traveling this river of life and of health together. And I just can't say we could not be more proud to be in this two-row with you all. So again, my name is Catharine Grimes, and I'm a director at the Bristol Myers Squibb Foundation. At the Bristol Myers Squibb Foundation, we focus our support on communities that are most at risk of suffering the impact of serious disease, on people who are the most vulnerable and face the biggest obstacles to receiving quality care. Over the past year, it's become clear to the world what we have known all along, that certain communities suffer more than others due to a number of deeply ingrained institutional factors. Our goal is to empower our grantees to build innovative solutions to advance health equity, to help the vulnerable overcome the barriers and receive equitable access to quality healthcare. Roswell Park is an excellent example of an organization that is building an innovative solution to a very deep-rooted and daunting challenge. And I am thrilled to be here with you this morning to launch this exciting project. One of the things we at the Bristol Myers Squibb Foundation are most excited about with this project is that it is so well integrated into the community. We've been doing this kind of work for more than 20 years, and we've found that no matter where the program is, whether in the rural United States, in sub-Saharan Africa, Brazil, or China, the people being served must view the program or service as being a part of their community in order for it to be successful. We know that maintaining a steady presence within the community and building trusting relationships with tribal leaders and individual community members is critical to success in efforts to educate and provide the full range of care services. That's why we believe this program's focus on specialty trained patient navigators, and especially those from Indigenous backgrounds, which have not been included in the healthcare delivery services to date, is what makes this program unique, innovative, and well-equipped to reach its goals. Once again, I'll say we're proud to be a part of this meaningful work and delighted to offer the support and resources of the Bristol Myers Squibb Foundation to assist Roswell Park in bringing high-quality cancer care to people of tribal nations in rural areas of Western New York. Thank you.
Thank you, Catherine. Appreciate that. Before we get to questions, which again, would like to encourage anyone, please drop them in the chat. We would love to hear from you and anything that might be on top of mind for you. But I'm just going to circle back quickly with Dr. Haring and possibly Dr. Glaser too, if you guys have any additional thoughts you'd like to add in.
We're just very grateful and honored. We're ready to embark on this journey. I keep saying to really make this change for our future generations. With that in mind, we look forward to initiating the services in our community, hiring within our communities, and really making that a community base progression and service. So we're very happy to do that. It's really significant and it's really heartfelt that it's going to be something that'll be life-changing, I think, for our communities, and not only now but for future generations, and to work with Indian Health Services both at the tribal level, regional level, and national level is highly significant in this process as well, to incorporate policy into that and how we can sustain this for future generations to come. So Yahweh, we're very appreciative for the opportunity, and we look forward to working on this very important project. Thank you.
Dr. Glaser?
Thank you so much. I just wanted to echo what everyone else has said, but kind of also hone in a little bit on something that Catherine brought up, that it's very important for us to be working very closely with these communities, that our intention is really to partner and recruit for these positions within the communities that we're working with, and really help build a plan along the way of sustainability, because we want to continue these services for the foreseeable future. We want to just keep going, and we've been able to do this with other initiatives with urban federally qualified health centers that we've seen great success. So now this is really just taking it another step to building it out into a broader impact to our Western New York region, and also to the Oneida area as well.
Excellent. So one of the things that's sort of top of mind for me, Dr. Haring, if you would like to address this, is sort of what have you already seen in your years of working with these communities and also engaging with providers and residents?
I think I speak to this in a way not only for our regions, but I think for indigenous nations across the United States, over 550 federally recognized Native nations, and even the 500 bands that are in Canada and the many indigenous nations across the world. That it's always been a challenge, I think, for community members to really navigate that process. And if you have a challenge, and for instance, leaving the reservation or the reserve into cancer care, sometimes it's a whole new world when you enter into a medical facility, and you also have a lot of things going on with, perhaps with a diagnosis or other issues that are occurring, And so to really have somebody that's trained to navigate that process from start to finish, there's no better way to really kind of bridge that important journey. And by doing so, it allows for somebody to go through the full continuation with not only comfort but kind of cultural compatibility of what that means. And there's a lot of meaning beyond just the journey. So there's a lot of cultural integrations in that journey too that are perhaps different than a westernized view of medical care. So to have an indigenized or a culturally sensitive approach to that is of the utmost importance for mind, body, soul, and health overall. So, I think that's one of the important things that I've seen, and in our region, Western New York and beyond across the Confederacy, Haudenosaunee Confederacy of Nations in New York, there really hasn't been that cancer specific navigation for the continuum of care. And we also are appreciative of the virtual component that was supported because during the pandemic, it's really been a challenge for people to have an outlet to talk to or to navigate into services or just field questions regarding cancer. And so I think the virtual piece is very important to serve, not only in a local context, but to reach out, for example, to the Akwesasne Mohawk in St. Regis in northern New York, even through the Onondaga Nation, Oneida Nation, and all the way coming back east to Seneca Nation and Tuscarora and Tonawanda Band of Senecas and in the whole Haudenosaunee per se. So, I think those are the important things that we've really thought about that. And really the other part too is the two-row, as we keep bringing up, is if we create health of an individual, whether the individual is native or non-native, and to really build that partnership of care, that we create healthy individuals, which then create healthy families, which then create healthy communities, both native and non-native. We're starting to build this kind of process of working together for community wellness beyond just one person. And so that navigation is really part of that. And we're very appreciative for the opportunity to move this new service forward.
Great. We do have a very timely and relevant question that has come into the chat. And it might be a combination of Dr. Glaser and Dr. Haring addressing this. But so we've seen during the pandemic a sense of mistrust or skepticism among some communities about healthcare, i.e. about the vaccine. Is trust in the healthcare system an issue within the Indigenous community? And if so, how may this initiative build trust?
I'll just go ahead and jump in a little bit, but I'm sure that Dr. Haring has more to say about this as well. I think, when it comes to particularly Indigenous communities, there is a deeply rooted mistrust in the medical system for historic reasons, right? There's tremendous historic trauma that has occurred that it would be just horrible for us not to recognize and honor that. And that's why even more so these partnerships are very important in building trust, establishing these relationships and making sure that we can help bridge those understandings. It's really a very timely question. We've also, seen a lot of other issues related to the vaccine in particular for COVID-19 in the rural areas as well, in terms of access to the vaccine and having the infrastructure to deliver it. So we're also in parallel looking at a number of other initiatives to help leverage these relationships that we're building to piggyback on that and address the COVID-19 issue as well.
Dr. Haring, anything to add on that? I know you have addressed in the past, the trust and the beliefs in Western medicine versus listening to leadership in Indigenous communities. So anything else you're willing to add would be great.
Yeah, over time there's always been this mistrust of perhaps not only just medical, but just kind of the change that have happened from our ancestral activity and ways of life from the beginning of time until now. And so, and that spans across not only medical but other realms too. And so, the important part I think today is that it's being recognized, it's being understood and shared. Some of these things that have happened, and it's being supported in a way such as opportunities like this to address those in person with our community members. We have a lot of brilliant, smart, beautiful Haudenosaunee people that are, going to be part of this process of navigation. Our communities are just beautiful and full of knowledge and ways to help ourselves and continue on in health and wellness. The part of addressing that historical kind of medical mistrust, perhaps, is by doing things like this, by supporting initiatives like this, by allowing our Indigenous leaders to have an equal say in how things go. And that part of the Turo is also, I didn't mention that, but that part of the Turo is that it's a relationship as siblings, that that we stand together as equals in a way, although we may have different health care systems. We stand together as equals in order to create a healthy future. And that's part of breaking some and tackling some of those longstanding obstacles that have created inequity. Our services just like this that integrate both an Indigenous perspective and a Westernized perspective of medicine and navigation.
One thing I want to circle back on what Dr. Glaser was talking about earlier, which is the culturally competent navigators. Can you talk to me a little bit about the cultural competence training and how that's all going to work?
Sure. We did include in our plan having a very robust training opportunity for all of our navigators, and engaging some of the leaders when it comes to particularly training to work with Indigenous communities to address some of these issues that we're bringing up, and really be sensitive to the history and the values and philosophy that go along with it. That's really important when embarking on these types of adventures and initiatives. And so I think that's a really important piece. I'm a medical anthropologist, so I come at this as an angle that we have to do things in a culturally appropriate manner. We really have to have targeted education and materials that help address that and really think about the meaning and value for all of these things, particularly good health and well-being for all of our communities, and taking that sort of approach to really addressing it in a very culturally sensitive way.
Excellent. Thank you so much, Dr. Glaser. Any last comments or questions in the chat? I'm going to take an eyeball to this. Not seeing anything popping through. So with that being said, I think we're about ready to wrap everything up. So first, a thank you to everyone in the audience who has who signed up and wanted to participate and join today. We really appreciate you taking time out of your day to hear about our most important announcement. Again, should be out on our online newsroom. Take a look at that. We'll be getting something probably to your email very, very shortly. And then also thank you to Dr. Haring, Dr. Glaser, and Kathryn for also joining us today as panelists. We appreciate all of the information and all the time and effort that has gone into this, and we are so excited to see it all come to fruition. Now, if you have any additional questions or comments, you can feel free to contact my wonderful colleague, Annie Deck-Miller, by email, and she is Annie, A-N-N-I-E Deck, D-E-C-K Miller, M-I-L-L-E-R at roswellpark.org. And in case anyone has not seen this and if you want to pass it along to some of your friends and said, hey, take a look at this, the recording of this webinar is going to be posted onto our YouTube page for on-demand viewing. That all being said, have a wonderful rest of your day, a wonderful weekend, and thank you again for tuning in. Bye, everyone.